Laura, thank you very much. And I want to echo, just say good afternoon nearly to everybody, and echo the statements we made so far on another wonderful Retina meeting, which Laura and Neve and the team with Kevin have put together. It's phenomenal how you raise the game every single year, Laura. And I was just doing a quick calculation there. I've been involved in ophthalmology for 25 years. I've been a consultant for 14 years. And every Retina meeting, I get so much, it nearly feels selfish, and I feel an element of guilt to come in supposedly as an expert and speak about things. But I learn so much at every single Retina, and particularly the patient engagement day. And this morning has been no different. Really, to listen to Ian speak so openly, honestly and personally about his own challenges. And as a rugby fan, I'm delighted, Ian, that you stuck with rugby. We cheered you on in our house when you ran out for Italy for the first time. I'm glad you didn't go to Gaelic football. On a personal note, two of the worst eye injuries I've dealt with, similar to your own story, were actually from the Gaelic football pitch, one accidental and one deliberate. We heard this morning amazing talk from Peter and the team, and brilliantly presented with the contributions from around the country of how important that support for all of you living with sight loss, or those near and dear to you living with sight loss, have to endure. And the pivot around, I want to touch a little bit on that, about the reaction to the pandemic by fighting blindness and indeed eye care providers across the country. And then to hear Judith and Claire talk about a really challenging condition. When you listen to it there, eye care professionals, we've got to up our game. I've been aware of Charles Bonnet syndrome from my time at Moorfields, and it is something that we just do not spend enough time discussing, raising with our patients. I know there are a number of my own patients on the chat box there and on the panel, and we don't cover this off. And thank you for raising awareness. And I'll do all I can with my college, through the Irish College, with my colleagues, and through the Irish College of Ophthalmologists, to make sure we get that message out to embrace it. And finally, Laura, I have a bone to pick with you in putting me on the schedule after Claudette was a little bit unfair. How do you follow an inspiring, personal, heartfelt, informative message that Claudette has given to us there about her own personal journey and how it relates to all people living with sight loss, and not just those with inherited retinal degenerations? And Claudette, with your permission, I took a photograph of your final slide to go home and share with my own children when I get back to the house. So thank you very much for all of that. And Claudette, you've covered a number of issues around eye care and eye health that I'm going to cover this morning around the dietary needs. So I'm going to talk a little bit practically. There's a chat box and a Q&A box on the forum there. So I was making a decision about how long to make this talk. I'm going to try and keep it brief, because we normally have the breakout sessions at Fighting Blindness at Patient Engagement Day, which we obviously can't have this year, but I still wanted to have an ability for that interaction. So in the QA box, please put up your questions. If there are lots, we may not get to all of them, but put them up and I'll try and address them through the talk this morning. And I'll leave a little bit of time for that Q&A at the end, because we have a decent slot. When we talk about eye care, and really we're talking about prevention of serious consequences from any issues around eyes. And a lot of the hints and tips in the middle of the pandemic are the same as you would anyway. Don't ignore symptoms, particularly symptoms that persist. If you've got pain, sight loss, distortion that persists for more than 24 hours, go and see an eye care professional, such as your eye doctor, your optometrist, or attend your GP and get some guidance from there. Don't ignore these things. Unfortunately, over the pandemic, we had a number of cases where people did ignore symptoms. They were afraid to come into hospital. But as I'll explain in a few minutes, we have readjusted our whole environment, and the optometry teams have done that as well in their high street locations to make these places safe to engage with. So please don't ignore these symptoms and do attend us. I was at I had to dip out of the Retina meeting yesterday to go to the British and Irish Vitreoretinal Society meeting, which was also a virtual event, but it was disturbing to see the reports from all across the UK and mirrored in our own unit of delayed presentations of patients with retinal detachment to all those units, and adverse outcomes as a result of that. So it's not a feature of the second wave we've had since September, but I think it's a little early to call it yet. So don't ignore those symptoms. I want to touch on one very common condition, blepharitis, and which is not genetic. It doesn't garner a lot of real research, but it's a very problematic condition for many people, particularly this time of year. So in my own practice, there's a spike in attendances for patients with painful, sore, itchy eyes, with discharge and tearing, particularly if they go out for a walk. And many of you on the call will recognize those symptoms. And that's really blepharitis, inflammation of the eyelids. There's two types of it. You can get a sort of a dandruff, sort of a little mite infection on the eyelids, which you clean off with a cotton bud or commercially available lid wipes like BlephaClean or Blepha wipes. But more commonly, it's due to the blockage of the oily glands just behind the eyelashes called meibomian glands. And these are modified sweat glands. And they provide the lipid or the oily part of your tears, which give your tear film stability. And when they block up, they cause local inflammation and irritation, but then you can't get the tears into the tear film. So that's why you get excess tearing as a response to that, and then you get irritation. So just simple measures like warm compressive massage, a face cloth in warm water held over the closed eyelid, and massage your eyelid just like that. Apologies to those who can't see what I'm doing. You just massage the eyelid, and that will settle a lot of those symptoms down. And I just want to make a note about that as Claudette said, irrespective of your underlying eye condition, you can still get a lot of these symptoms can affect you, particularly when it gets cold this time of year. And that you may be able to manage a lot of that just yourself. I want to talk about specific issues around the pandemic and how, explain how we reacted to it in March and April and how it suddenly seemed it was difficult to get access, how we've pivoted in the meantime, and how you access eye care services now. And I think that really is quite important. Back at the beginning, there was a lot of concern. Patients with COVID-19 also had, some of them got a viral conjunctivitis. So nobody with a conjunctivitis was getting into an eye unit. They were asked to manage conservatively and stay away from the busy eye departments. And we're still more or less keeping that advice on board. The major eye emergency departments, particularly at the Royal Victoria Eye and Ear and ourselves here at the Mater Hospital and others around the country, no longer run a walk-in service. So you do have to get a referral and email or phone in with that referral, and then you'll get a booked appointment. So when you do get a booked appointment, that you will get that a slot, but attend for the slot at that time. And when you get to the hospital, you notice a lot of measures will have been taken around the hospital. You'll get a phone call before you come to make sure you don't have symptoms of COVID-19 or been in close contact with somebody with COVID-19. When you get to the hospitals, hand sanitizers everywhere. You'll be asked to wear a mask through your hospital visit. You'll notice that there'll be fewer people in the waiting area than you would maybe normally be used to. The staff will be behind Perspex screens, and a lot of the equipment have Perspex dividers. That's to keep you safe and to keep the staff safe. So just that you're aware of that. We're in the middle of doing a video here at the Mater Hospital, but in the meantime, there is a video available through our colleagues in the Belfast Trust in Northern Ireland, the Macular Clinic, and afterwards we'll get that posted up, a link to that video, and it's very similar to what we have in the eye units around the country. So that's just how you get your appointment, say for an eye emergency, and that you will attend at a specific point in time. We will say to you, if you do get an appointment, please come for your appointment. Don't be so scared about going into the hospital. It's not like back in April. The hospitals are actually relatively safe places to come and visit, provided you obey all the rules. So if you get an appointment for a screening appointment for diabetes, for an eye emergency department, for your clinic, and particularly for surgery, do attend for that appointment. When you're coming to the hospital, you'll get a phone call ahead of time with all your screening questions. Answer those truthfully. We've had a few situations where they haven't been, and it causes a bit of distress on the day to everybody concerned. Somebody bringing you to hospital, if at all possible, they stay outside, and then you come on inside and attend your appointment. If you're coming for an operating list, you may be also asked to have a swab before coming in, particularly for a general anesthetic, and that you make that appointment for a swab. So if you don't have a clear swab, you won't be able to come in for a general anesthetic. This is very important for you and for the team. People who are COVID positive have a greater risk then of transmitting that under general anesthetic to anaesthetists and to other staff members. And if somebody is COVID positive and has a general anesthetic, there's a significant mortality rate from that situation. So it's in your interest, if you are COVID positive, that you do not undergo a general anesthetic. So it's for the safety of everybody. And you'll come at a designated time. Now, the benefit of all of that is that you'll find your actual patient experience, and patients have relayed back to us that they find it an awful lot more timely, they're seen in it quicker, and the time actually in the hospital is much less. They're the general features, and Claudette touched on this there around inherited retinal degenerations. And in this era, and as well, it's been one of our disappointing things that our own IRD clinic in the Mater has had to step back because it was deemed non-essential clinical care. But we've been able to manage and pivot the team to actually deliver that care over the phone and by virtual clinics. I'll talk a little bit about that, how we've kept our counselling service in particular going. There's parts about the condition we've inherited retinal degeneration that you can't change, the underlying genetic alteration, and with gene therapy we hope to modify that. But Claudette touched on this. Don't forget that you're also at risk of developing cataract, glaucoma, macular edema, and these need to be addressed and dealt with. So, and then, and even if not, if there's progression in your vision deterioration, that we can get you access to the rehabilitation team, to the eye clinic liaison officer, and those supports that were touched on in Peter's segment earlier on from many of the people that came on. And that is very important, not to ignore those symptoms, so we can actually manage those comorbidities along the line. With macular degeneration, I want to make a couple of specific points. One, if you're on a treatment regime, you should continue to come for your injections. We did not stop injections in the first phase for those that most needed it. We restarted our full injection service in May, and that has been the case since. So please come for your injection appointments and do have it. We have everything set up to be safe, and we have the average time in the hospital for a patient coming for injection at the Mater. You are in the hospital for between 20 and 30 minutes and no more. With that in mind, I also want to point out that a recent paper came out. So those with patients with macular degeneration, if they do get COVID-19, are at greater risk of having a serious adverse outcome, either needing respiratory support or intensive care treatment and support. So we ask you to be extra vigilant if you do have macular degeneration around any potential COVID contacts, and that you look after yourself by following the regular rules as given out by our public health experts. I'm just going to stop there just for a second. I want to just answer some of the queries that have come through on the screen there. And there was one that was put up. I'm going to one that's up in front of me. Was around, there was one that was up in front of me around vitreous detachment. Vitreous detachment should not cause sight loss. Now, if you've got macular degeneration and cataracts, that can be addressed, and that you to talk to your eye care provider about that. Somebody asked about tuberculosis. TB is still with us. It can still affect people. And if you do have or you're diagnosed with tuberculosis, yes, it can cause inflammation inside your eye. And then to deal with that, if that is an issue, but to discuss that with your eye care provider. There's a question here about amblyopia, is otherwise colloquially known, and I hate the phrase, as a lazy eye. And amblyopia usually relates to an issue you might have in childhood where you have a squint, or one eye is more short-sighted or long-sighted than the other, and the eye vision pathways don't develop as completely as would be the case in normal situations. Unfortunately, there's no active treatment for amblyopia at the moment. There's a question here about retinitis pigmentosa, about somebody not wearing their sunglasses. Look, as a basic premise, reduction in exposure of the retina to ultraviolet A and B light will protect it. They are oxidating wavelengths, and they can cause oxidative damage. So when you've got compromised retina, you try and minimize your exposure to ultraviolet light. So basically, we have to minimize that exposure, and the wearing of sunglasses helps in that regard. But it's up to somebody to make their own mind up whether they're going to wear them or not, but they are beneficial. There's a question here about ophthalmologists specializing in aniridia. Yes, you're looking for an anterior segment specialist, and there are a large number of those in the country, but usually aniridia becomes apparent in pediatric population. So if you look to pediatric specialists such as Catherine McCreary and Donald Brosnan in Crumlin, and in Temple Street, we've got Sarah Chamney, Stephen Farrell, Susan Fitzsimons, and Ian Flickcroft. So it's a large number that would look after a child with aniridia. Just had a quick other question coming in here. So somebody here with congenital glaucoma and a cataract. So congenital glaucoma, you're under the age of 16. Those pediatric ophthalmologists I've named there will see you. Specifically, I know Stephen Farrell and Sarah Chamney in Temple Street, and over in Crumlin, Donald Brosnan and Catherine McCreary, and we've got a fabulous new colleague, Claire Hartnett, who's just joined the team on both sides. So really, it's up to the clinical team to determine how appropriate it is for you to go have surgery. So somebody's just asked about retinal reattachment surgery. Retinal reattachment surgery is very successful, and usually we fix about 90% of these, about 10% redetachment rate. But even with that, the final reattachment rate nowadays is around 98, 99%, and the vast majority of patients, about 70%, retain or regain very good vision. Okay, I might just pick a few through here.
David, I think we just have maybe a minute for one or two questions, and allow people to get some coffee before we go into the afternoon.
Perfect. But I'm going to just briefly, I did want to touch on some of the other, on some of those, but we're living in very strange times. And I stress again the importance of the standard techniques around distancing, hand hygiene, wearing a mask, and limiting your direct contacts. The medical system in Ireland is open. We are not overwhelmed as we potentially were back in April and May. So please go and make your appointments. We've managed to pivot a lot of change, and the future is very, very encouraging in this regard. There's a lot of process change through lean process management, so you'll find much more efficient units from here. We have embraced technology, and our own unit have been able to bring in things that we had planned for 3 or 4 years, and we've been able to bring them in over the last 6 months. Manage patients at home, change your care to the community, limit the number of times you've got to come into the hospital, virtual access to experts, are linking into the European Reference Network Rare Eye Disease Consortium so that patients with rare conditions can get ready access to continental experts. We are using our time. We've done a lot of things. We've cleared our backlog around counselling. We've commenced our pediatric screening program. We've set up clinical trials, and now doing counselling, as I say, by video calls. We've increased our genetic testing capacity, and we've opened up new pathways for that, and we're well on the way to being able to have that available at the Mater. We talk about starting clinical trials, and it's been touched on a lot this morning. So we have a study starting on anxiety and depression. We're hoping to run that through Fighting Blindness. So those of you on the line, please stay alert and watch the Fighting Blindness website. We will be recruiting patients for that. Mind your sight, it's precious. Mind yourselves, you're even more precious. And Laura, thank you very much for having me on this morning.